You just brought home a new cat or a dog. Maybe you found it wandering on the street as a stray, or maybe you rescued it from a neglectful situation. You bring it to the vet for a checkup, and the doctor starts discussing spaying or neutering. You now have a decision to make, and I am here to help you make the right choice. The term spay refers to the surgical removal of the ovaries and the uterus of a female animal, and the term neuter refers to the surgical removal of the testicles of a male animal. According to Lollipop Farm, approximately 15 million pets are sent to shelters across the country each year. This doesn't even include all the pets still left on the streets that don't make it into the shelters. This overpopulation is getting out of hand. Even if you're not planning on breeding your animal, accidents happen. They might end up mating with your friend's dog that you didn't know wasn't fixed, or they could accidentally escape outside and mate with something out there. And no, animals will not hesitate to mate with their biological sibling, which in itself can cause a genetic disaster. If your dog or cat ends up pregnant or ends up getting something else pregnant, you are now responsible for that litter, which typically consists of multiple babies. You're responsible for feeding them, caring for them, making sure they have access to vet care, and making sure they find good homes, all of which is not typically cheap. Pregnancy is usually a burden for a dog or a cat. It is painful and can come with complications such as babies getting stuck in the birthing canal or a retained placenta, both of which come along with emergency surgical procedures that typically cost a minimal of a few thousand. As also mentioned by Lollipop, the more animals there are on the streets, the more likely they are to affect humans. There are diseases such as rabies that are zoonotic, meaning that animals can transfer them to humans. If these animals are on the streets, they are unvaccinated, and they are more likely to bite or scratch humans or other animals, continuing to spread disease. If they are wandering freely, they can also wander into the streets and cause traffic accidents. There are many benefits to altering your pet other than just stopping reproduction. For males, as mentioned by the American Society for the Prevention of Cruelty to Animals, also known as the ASPCA, neutering them can prevent testicular cancer and can also help prevent certain prostate issues. Some behavioral issues can be solved by neutering them as well. Males are less likely to want to wander away from home following that urge to find a mate, and inappropriate territorial urinary marking and aggression due to built-up testosterone can be decreased, if not eliminated, if the animal is neutered before these become learned behaviors. Cornell states that for females, spaying them can prevent a pyometra, which is an infected, pus-filled uterus. Pyometras typically develop from a buildup of bacteria and due to hormonal changes due to recent heat cycles. A pyometra can be either open, where the cervix is open and the pus is allowed to drain, or more emergently closed, where the pus is trapped in the uterus. A pyometra surgery is typically more risky than a typical spay, and the surgery can typically cost a decent amount more. Spaying a female can also immensely lower her risk to develop cancers like mammary masses, and it also prevents them from developing painful cysts on their ovaries or uterus. Always make sure you talk to your vet about the risks and benefits of spaying and neutering. Although there are risks, as there are with any procedure, including any procedure that humans get as well, the benefits vastly outweigh the risks. Make sure you also discuss the timing of spaying and neutering with your veterinarian. Like discussed in the article by Ross University, every veterinarian has their own preference for timing. But the most common recommended age to spay or neuter your dog is 6 to 9 months old. However, for example, it is typically recommended that larger breeds be fixed after they have had time to fully mature, being less likely to cause early issues related to bone and joint health. It is safe to spay or neuter a cat after 8 weeks of age, but it's typically recommended you wait until about 4 or 5 months old. Along with age recommendations to fix your pet, your veterinarian will also most likely recommend preoperative measures such as a physical exam and lab work. This will rule out any obvious risks before doing a procedure. A physical exam would rule out any physical abnormalities, and any issues with the heart and lung sounds. The lab work will make sure nothing internally is going on that will obviously react with any of the medications or anesthesia that your patient would receive, to make sure that they're going under in the safest circumstances possible. In any reputable hospital in New York State, your pet will be closely monitored by a licensed veterinarian while under for the surgery. The licensed technician will alert the doctor if anything like blood pressure or heart rate seem off, and they will make changes to the anesthesia and the medication to make things as safe as possible. Your pet will get adequate pain control either during the procedure, after the procedure, or both. And then in 10 to 14 short days, your pet will be all healed up and back to normal. However, keep in mind that a male can still reproduce for up to 6 weeks post-op. Cost varies depending on where you go, but you can always ask for an estimate beforehand, and you can always inquire about a low-cost shelter or clinic.